Depression by Monica Hubert. What is depression? Depression, which has also been called major depressive disorder, MDD, is a chronic illness that is oftentimes recurring and can be life-threatening. MDD is expected to become the second most disabling disease worldwide by the year 2020. Currently, it is the third. According to our text, only 21% of those suffering from depression are adequately treated, and depression is responsible for 40% of all suicides. Depression is an affective disorder, which means it is marked by changes in emotions or mood, and sometimes to an extreme level. People who suffer from depression don't look any different than anyone else. You cannot see their symptoms by simply looking at them, and sometimes it is too late to help them by the time they are diagnosed because of the lack of physical symptoms. Neurotransmitter theory. Depression affects the monoamine neurotransmitters in the brain, and these the most often. Serotonin, which is found most in the gastrointestinal tract, central nervous system, and blood platelets, help create a sense of overall happiness in an individual. Norepinephrine, which is found in the brain within cell neurons and helps with focusing the mind. This neurotransmitter fluctuates depending on the level of stress in any given situation. Dopamine is also found in the brain as well as the body. This neurotransmitter helps with reward response. It can increase based on the type of rewards and will often increase when addictive drugs have been used. Depression is said to be caused by the dysfunction of these neurotransmitters within the brain. Medications are prescribed to help these neurotransmitters function at a more normal level. Antidepressant drugs are currently being used to repair neurons and increase neurogenesis, which is the birth of new neurons. Tricyclic antidepressants are a class of antidepressants that relieve symptoms of depression, as well as possess significant anxiolytic and analgesic actions. Today, the most often prescribed for depression are selective serotonin re-up inhibitors, SSRI. They are less toxic and have a lower acquiescence rate, making drug therapy more likely to succeed in patients who have an aversion to taking medications. These drugs do two things to help with depression. They block the presynaptic re-up transformer for the norepinephrine and serotonin, and they block postsynaptic receptors for histamine and acetylcholine. When treating with drugs, it is important to look at the possible outcomes of the drug therapy. These outcomes include the possible effectiveness of the drug as well as the individual's tolerance of the drug to treat the depression. Some benefits of treating with the drugs would be the alleviation of the symptoms of depression to help the patient live a life with a higher level of joy while functioning on a more normal level. However, when treating with antidepressant drugs, there are oftentimes side effects that come along with the drugs. Side effects can include intestinal issues, drowsiness, anxiety, headache, and decreased appetite, to name a few. When deciding to not treat with antidepressants, it's important to create some type of cognitive therapy to help create a different way of thinking and feeling. The reason is that if there is no therapy with depression and no medications, the problem is still likely to negatively impact the livelihood of the individual and can lead to severe depression and possible suicide. Rate of success. In multiple studies about antidepressant use over the last 50 years have shown us that while there is an impact on major depressive disorder with the use of antidepressants, it is minimal compared to the level of people being diagnosed with MDD each year. The reasoning is not that the antidepressants don't always work. It is also that the side effects are too much for some people to withstand, so they do not take the medications, as well as some have bodies that are resistant to the medications altogether. The question 50 years ago was whether or not antidepressants work at all, and today we are still asking that question, pointing to the need for more research and studies done to finally answer this question. References.